The world's premier event in hematology just concluded. Scientists at the forefront of cancer research are exploring ways to work directly with patients' immune systems to fight cancers, including Hodgkin lymphoma. Oncologist and hematologist Dr. Jonathan Cohen joins us to share this breakthrough research. Good morning, doctor.
Hello, it's great to be with you today.
It's nice to have you. Before we get into the research, I want to start with a foundational question. What is Hodgkin lymphoma? Explain it.
So Hodgkin lymphoma is a type of blood cancer. It typically affects the lymph nodes of the body, and so often patients will have swollen lymph nodes in the neck or under the arms, for example. However, it can go to pretty much any part of the body.
Are there particular risk factors?
So unfortunately for most patients, we don't know why it is that they developed this disease. In some cases, there's an association with exposures to viruses like the Epstein-Barr virus or HIV, but that's the minority of cases.
The research just presented at the 2016 ASH annual meeting. What stood out to you?
So this was a very exciting meeting, both for researchers as well as patients that are living with this disease. Fortunately, the majority of patients, roughly 3/4, will be cured of their lymphoma with currently available therapy. But for the remaining quarter of patients, there are often limited options. And those are the patients that stand to benefit the most from the research presented at the meeting that just concluded. This is particularly impressive with some of the immunotherapy agents.
Yeah, it's intriguing to me. I'm not in your field. So I sort of feel like for patients, there's reason to be excited about some of this. So what are some of the benefits of what's coming down the pike compared to what's been available?
So traditionally, patients with relapsed Hodgkin lymphoma would receive conventional chemotherapy. This can often be toxic. It sometimes has to be given in the hospital, and the effectiveness was often very limited. However, with this new class of agents, these are often better tolerated and can result in remissions that last over a year, which was unheard of even a couple of years ago. And fortunately, roughly 2/3 of patients will benefit from these agents.
We have such limited time here compared to the meeting and the years of research that led up to the results themselves. Where would you send our viewers online and give us a taste of what they'll find there?
Sure. So I think the most important thing actually that your viewers can do is to go speak with their treating physician. They often will have access to some of the most recent information and can discuss whether or not one of these approaches may be appropriate for them. For those that are interested in going online, however, I often recommend the Lymphoma Research Foundation at lymphoma.org or the Leukemia and Lymphoma Society at lls.org. Both of these foundations have excellent materials online.
When research is presented at a meeting like this, and it happens annually, how long does it take for that to start to filter in to what patients might experience day to day?
So that's an excellent question. It's important for patients and families to remember that much of the data presented at the annual meeting are from clinical trials that are either just concluded or some of which are still ongoing. And it may be a while before those findings make it into routine clinical practice. Fortunately, in this case, however, nivolumab, one of these agents, is currently FDA approved for relapsed lymphoma, and so some patients will have access to this medication immediately.
Awesome. Dr. Jonathan Cohen, thank you for taking the time to join us today. We appreciate it.
My pleasure. You have a good day.
You too.